Hello everyone. Today we've got Dr. Amit Varma, who was a UK-based GP and is currently working in Qatar. Hello, Dr. Amit. How are you doing today?
Hi, Jinit. Thank you for having me over. I'm doing very well, thank you. And how are you doing?
I'm good, thank you. I'm currently working on a COVID-19 project and have a few questions for that.
Yes, please, fire away. I'm here to answer your queries.
Okay, Dr. Amit. Currently, looking at the statistics in Qatar, I think Qatar is doing pretty well, looking by the recoveries and the death rate and the total cases.
It's interesting. I think worldwide, the COVID has just changed the scenario completely. The way people have been looking at managing healthcare problems has completely taken a U-turn, hasn't it?
Yeah.
Uh, Fortunately, having been in Qatar over the last few years, I'm noticing that the COVID situation here, although the cases are quite high, we're probably fourth on the list in terms of the number of cases per million population.
Mm.
So we have about 21,000 cases in Qatar who are COVID positive, but our death rates are quite low. We have about 13 deaths,
Mhm.
which is much, much better than any other countries in the West at this stage. Um, there are probably two big factors which might be one of the reasons for this. One factor could be that the population in Qatar is mostly the expat population who are younger. So most of them are less than 60 years of age.
Mm.
So that might be one of the reasons why we do not have lots of serious or critically ill patients.
Mm.
The second point might be that, which is a speculation, that the strain, there has been speculated that the COVID-19 has two different strains, the L strain and the S strain. And the L strain is known to be a bit more aggressive as compared to the S strain. So we are postulating that it's probably the less virulent strain in Qatar, and that's probably why we're managing a little better than other countries are.
Mm. Thank you very much. That was really helpful. Is there any medical shortage in Qatar?
Well, with the COVID scenario, this has come to us completely out of the blue. So nobody was expecting this to happen. No one was prepared for this in terms of expecting a pandemic happening so soon. Yes, we had plans for any disaster happening, which every country does, and the WHO guides us for this as well. But for this to happen so suddenly, I'm sure that no country was completely prepared. Yes, we have had steps for it. Similarly, as the UK, Qatar also has had steps for it. They've had doctors in line on duty, and they have created COVID centers. They have created different hospitals as dedicated COVID hospitals. We have been recruiting more doctors and nurses from abroad as well to help us out because we all need doctors. The healthcare facilities are desperately in need of help
Mm.
across the globe, across the world. So Qatar is no different to that, but we're trying our best and we are trying to manage with what we have.
Yeah. Thank you very much. How are you coping up with other emergencies during the COVID-19 pandemic?
Well, the COVID-19 pandemic has shaken us all. We have dedicated COVID centers, but that doesn't mean we do not have other places running the healthcare emergency facilities as well. So we have in Qatar, for example, we've dedicated four healthcare centers for COVID, but the other 20 odd healthcare facilities are still running as normal to help and look after people with other ailments, so like diabetes, hypertension, any other medical problems, pregnancies, pediatrics, everything else. So we've diverted the people who have possible COVIDs to one particular setup, and we have still kept the other hospital setups running so as to manage the other emergencies because these both go hand in hand. Having COVID doesn't mean we will not have any other emergencies.
Yeah.
We do have both. It's a very delicate balance, and that's changing on a daily basis.
Mm. Thank you. Has Qatar taken any step developing a vaccine?
That's a very interesting question. I think across the globe, all countries are really pushing their limits, pushing their scientists to find a vaccine because we all know that that is what's going to help protect us from COVID-19. Qatar is also doing the same. They have an eminent team of scientists who are working day and night on trying to develop a vaccine. We all know that realistically, this might be 6 months, a year, maybe more. We don't know. But we are really hoping for it. There has been news recently that Qatar has been teaming up with scientists from Italy, teaming up with scientists from Russia, and perhaps from a lot of other countries as well. So it's a lot about information sharing where people can help each other because this is about humanity.
Yeah, thank you. What do you think we should do to stop the spread of this dangerous virus?
Well, the message at the moment out is very loud and clear, isn't it?
Yeah,
Um, the social distancing measures, which has been advised for people, 2 meters apart, staying at home, avoiding your T zones, avoiding touching your nose, mouth, and your eyes, because these are where you can kind of infect yourself with viruses. Wearing a mask if you have to go out, and as much as possible, stay away from anyone else. Stay at home, that's the best thing. In India, for example, they have divided zones into green zone, orange zone, and red zones.
yeah.
Red zones obviously are highly infective zones, the hot spots. Green zones are the safe zones. Um, my advice would be the only green zone is your home.
Mm.
Stay at home for now until we have a vaccine, B, a cure.
Very
Okay?
true. Very true. Thank you very much. What do you think the post COVID-19 scenario will be in the world?
That is another interesting question. That kind of opens up a completely different picture, doesn't it?
Hmm.
No one really expected this to happen. The Spanish flu happened in the 1918-20, about 100 years ago, and things very similar has happened this time again. I think things are going to be very different after this. As humanity, we should, I think, all share and help each other, be kind to each other. It might be a difficult scenario where the rich might become more richer and the poor might become more poorer,
Yeah.
which might be a shame. But I think what we should also do is to share, to give, try our best to work for the human race. Um, I can see that the economy is going to take a bashing this time. We might go back a few years, few decades even, in terms of the economy. But hopefully, if we all team up together, if the countries team up together and work as a team, it just kind of comes back to me with the instance of the movie from Independence Day, where all the countries of the world team up together to fight the aliens.
Hmm.
So at the moment, COVID-19 is an alien for us. Yes, it's an unknown devil for us, isn't it?
Yeah.
We are all fighting against it. So if all of us as countries come up together to fight this off together, support each other, I think the world in future will be a very different place to evolve.
Yeah. Thank you very much, Dr. Amit. That was extremely useful. Thank you for all your valuable time and expert comments.
Thank you very much, Jinit. Thank you for having me. All the very best to you. Stay safe and spread the awareness as you already are doing. Well
Thank
done to you.